Metatarsalgia refers to the onset of pain in the front part of the foot, right at the level of the pad, fat at the base of the toes. In this exact place are the heads of the metatarsals, long bones that run from the ankle to the toes. Therefore, the word metatarsalgia refers to the inflammation of the heads of the metatarsals. This inflammation is caused, in most cases, by excessive support on the heads of the second and third toes for various reasons, which we will see next. There are many other foot pathologies that can cause pain in this area and that can sometimes be associated with the development of metatarsalgia, such as stress fracture, Morton's neuroma, or Birnian, among others. Access more than 500 videos through my application, downloaded in the top right corner of the screen. The main symptom is pain in the area of the fat pad of the foot just behind the toes, especially at the level of the second and third toe. The pain worsens when the patient stands, runs, or bends their foot. It also increases when walking barefoot on a hard surface. On the contrary, the pain decreases when the patient rests and elevates their foot. Sometimes it presents as a sharp pain or a numbness or tingling in the toes. We can also feel it as if we had a stone under our toes inside the shoe. In addition, this hypersupport or excessive support that is generated around the second and third toe causes our body to generate a callus to protect itself from constant pressure. So, it is very common to see hardness in this area. We are going to divide the causes into two groups: anatomical causes linked to the structure of the foot itself and external causes linked to the lifestyle you have. In structural causes, we find the Greek foot, a foot in which the second and third metatarsals are longer, a foot that we find in up to 15% of the population. This favors excessive or hypersupport of the heads of the second and third metatarsals, increasing the chances of suffering from metatarsalgia. The flat foot or the foot arch are two deformities of the arch and vault. Plantar that unbalance the distribution of loads during the step, favoring the support on the heads of the second and third metatarsal. Claw toes are often simultaneously a cause and consequence of metatarsalgia. The twisted position in dorsal flexion of the first phalanx reduces the support on the toes and increases it on the metatarsals, thus favoring the appearance of inflammation and pain. Finally, the shortening and loss of flexibility of the posterior chain, that is the plantar fascia, calf, and soleus, also contributes to the onset of this problem. The weakness of the foot muscles, especially the lumbrical muscles, can also favor the fall and collapse of the metatarsal arch, as also happens with the foot arch in the flat foot, flattening the area of the second and third metatarsal, thus generating excessive support. We move to the second classification. External causes. The use of footwear with little sole, with too much heel or narrow at the front, favors the appearance of pain in the form of metatarsalgia. This type of footwear is very much associated with women, and its long-term use can favor other types of foot pathologies, such as bunion or Morton's neuroma. Obesity not only favors the appearance of metatarsalgia by adding more weight to the foot support, but it contributes to the appearance of many other cardiorespiratory diseases. Always try to maintain a healthy weight and perform 150 minutes of physical activity a week. The aging of the foot is associated with the loss of fat that forms the pad of the fingers exactly at this level. With the loss of the natural cushioning of our metatarsals, it is more common for there to be excessive support and discomfort to end up being generated. Suddenly practicing sports or exceeding your limits by taking very long walks will also promote inflammation in the area and the onset of pain. If you do an activity that your foot is not used to, it will end up complaining in the form of pain. This type of metatarsalgia is more acute and requires a different treatment, which we will see a little later. Metatarsalgia sometimes hides more serious pathologies, such as stress fractures, that can occur when performing more intense sports activities, such as, for example, running a marathon. Although they can also appear in weekend athletes who push too hard in a game. The best way to rule out this problem is by having an X-ray. In addition, there are also other diseases that could generate a pain pattern similar to that of metatarsalgia. You can find them to my right. The first sign is pain upon palpation. If pain appears when palpating the pad of the fingers at the level of the second and third metatarsal, we could be dealing with a case of metatarsalgia. The appearance of a callus or hardness in the area supports this hypothesis. However, I always recommend getting an X-ray to confirm the diagnosis and rule out any type of fracture in the heads of the metatarsals. In addition, we should never lose sight of the other pathologies I mentioned a moment ago, which, although they do not appear frequently, can lead to the failure of the metatarsalgia treatment. To personalize the treatment, we have to divide metatarsalgia into two major classifications: acute metatarsalgia, pain that only appears linked to an activity. For example, after intense activity like going for a long walk or going for a run, by wearing heels for a long night, or by standing all day. This type of pain is sharp and is characterized by a sudden onset and lasts between 1 to 3 weeks, gradually disappearing. For this type of metatarsalgia, we must implement an anti-inflammatory treatment where rest prevails. To protect the foot, avoid taking very long walks or standing all day. Apply ice for 20 minutes, 3 or 4 times a day, always using a towel to protect the skin. Place your foot in an elevated position, always above your waist. If your doctor has prescribed it, take some painkiller to help you cope with the pain. Especially if you have to continue doing activities during the day, use footwear with a thick sole that is wide at the front of the foot. Apply this bandage to relieve the support on the heads of the metatarsals. You can also apply this massage to relieve the irritation of the metatarsals and the adjacent musculature. Finally, if the episode appears very recurrently, once the pain decreases to an intensity of between 3 and 4 on a scale of 0 to 10. Should you also review the treatment proposition for the chronic cases that I'm going to tell you about next? The second classification is chronic metatarsalgia. We've talked about acute metatarsalgia, now we're talking about chronic, a constant metatarsalgia that has been with us for several months. That prevents you from carrying out daily activities and is not necessarily linked to any specific activity. It's simply a constant pain that appeared a long time ago. In these cases, we need to review the lifestyle and apply certain criteria to reduce irritation and pain. Firstly, a weak foot is equal to a dropped foot. Performing exercises like the ones I propose here is the first step towards a pain-free foot. Maintaining a healthy weight, avoiding the use of closed footwear, reserving it only for special occasions, are two important points to work on. Footwear should be flexible, have a hard sole, and be wide at the front, in addition to not having any type of heel. Making custom insoles, going to a podiatrist who performs a gait study, is another indispensable step. Finally, if all else fails and you still have high levels of foot pain, will you be a candidate for surgery only as a last resort? In this surgery, pressure areas on the heads of the metatarsals are relieved through small cuts in order to raise them and distribute the loads on the footpad correctly. It is usually an outpatient surgery with local anesthesia, where the patient walks out on their own. The results are very satisfactory after a month. Very well, friends, that's all. I hope all this information helps you better understand metatarsalgia and is useful when making a decision about your treatment. If you've made it this far, it's because you're enjoying the video, because it's useful to you, or maybe you're in love with this bald head. Subscribe so you can see it more often and share the video with those who need it. If you're looking for personalized attention and a program to solve your injury, you can contact me on my new platform, physioterapiaalcans.com, so I can take care of your case personally. Greetings, I hope to see you again in the next video.